Topic on nursing documentation. Okay, this is how we will write our nurses notes. Okay, the objectives we have to define documentation in nursing practice. Okay, state the purpose of documentation in nursing practice. Share the core principles of effective nursing practice. Okay, state the core principles of effective documentation in nursing practice. Explain the importance of using proper spelling and grammar when documentation. Okay. Now the definition is, this is anything written or electronically generated that describes the status of the client on the care of service given to the client. Nursing documentation refers to written or electronically. We have now this in the system. We already started some department, but some in that department still we are using these forms. I will show you the forms later. Okay. This it was to promote good nursing care, okay, to establish accountability, to meet professional and legal standards. This is also for quality improvement and providing data for research and data collection. Like if we are going to present a case, of course we have to refer to our nursing documentation or the patient's file so that we can present a case. Okay. Now, principles of records, no problem, you can take it. Okay. Timely, objective, and accurate. It should be complete, concise, and legible. Okay. We have the types of documentation system. We have the problem-oriented documentation, source-oriented, which is traditional, focus documentation, charting by exception, and clinical pathways. Okay. Now we have the problem-oriented or by or up. Okay. A stands for assessment. Okay. A stands for problem. I is for intervention, and E is for evaluation. Okay? Now we have the example. This is the example of nurses notes. Okay? For API. You see, time. Now your assessment. Okay? You will assess now the patient, and this is your nurses notes. So upon your assessment, patient twisting on bed and frowning. Okay, this is your assessment. So this is, you will write the nurse's notes. Patient twisting in bed frowning. So this is your assessment. So now, why the patient is frowning? So you will go now to your problem. What is the problem of the patient? It's the pain. That's why she's frowning. So how you write your nurse's notes? Pain at incision site related to cesarean section yesterday. So that's why she's frowning. So, and then at 0915 hours, what is your intervention? Okay, that is your nursing care. So what you write? Medicated for pain as ordered by the doctor. So that is your nursing intervention. Okay? At 10:30 hours, after giving the medication, what is the outcome? What is your evaluation? So what you will write? After the medication, of course, sleeping quietly on bed. Okay, that is your API example. And then after that, you will write your name here and your salary or computer number. Okay, we will write our computer number. That is for API. Clear? For API. Okay, we'll proceed. Another one is problem-oriented SOAP or SOAPier. That is subjective, which is the patient will verbalize to you. Okay? Objective, which is the one you will observe from the patient, what is the complaint of the patient. Okay? And then A for assessment, P for planning, I for intervention, E for evaluation, and R for revision. Now we have the example of this nurse's notes for SOAPier. Okay? Okay, we will continue. This is the example of nursing documentation by SOAPier. Okay? SOAPier. See the example. This is example 0800 hours. Subjective, patient stated. She was telling you I feel dizzy when I move from the chair to bed. That is subjective. Now the objective, patient had unsteady gait and held the chair, beside table and bed moving when moving. Blood pressure 160 over 100 millimeter per mercury. Pulse rate is 98 beats per minute. Respiratory rate is 24 cycle per minute. So, this is objective. You are the one, observe the patient, okay? And you are the one who check the vital signs. That is your objective. Now, this is assessment, okay? Since the patient have this unsteady gait, she's high risk for what? She's having dizziness. So, high risk for? Fall or injury. So, what you will write? Your assessment, high risk for injury related to sensory and motor deficit. Okay? And then, what is your plan? Since the patient is high risk, so what is your plan is to assist the patient with all the ambulation, instruct to use call bell, and call for assistance when getting out of bed. Okay? And then what is your intervention or implementation? Okay? So your intervention is call Dr. Smith, OBS resident, to report findings, repeat neuro check after 30 minutes, no new order received. So after this intervention, what is your evaluation? What you will write in your nurse's notes? Okay? Resting on bed, blood pressure 140/86 millimeter per mercury. Pulse rate is 72 beats per minute. Respiratory rate is 18 cycle per minute. Neuro exam within normal limits. Reassess in 1 hour. And constantly calls for assistance. Still experiencing dizziness. So your patient is still feeling dizzy. So what you will do? What is your revision? So your revision, since your patient is high risk for fall due to sensory and motor instability. So you have to continue to monitor your patient. So that is your revision. It's still the same. The condition is still the same. That what's the main revision? What is your next step? Okay? Now that is for Sophia note. Now we will go now. Source-oriented narrative traditional. Okay? This is the one nurse's note we are applying in our hospital. Okay? This is the one. Okay? Now the example of this nurse's notes, okay? Traditional, you see, at 0730 hours, on bed, taking spontaneous breaths on room air, fully conscious and coherent. Oriented to time, blood pressure 130/80 millimeter per mercury, pulse rate 85 beats per minute, respiratory rate 24 cycle per minute. SpO2, this is oxygen saturation, 98%. Peripheral lines intact on left metacarpal and cephalic vein. Okay? Gauge 20. You know this gauge 20? Okay. This is cannula size. Okay? Both patent on KBO, kept for emergency and medication purposes. Surgical site intact and dry, covered with gauze, no any oozing noted. So you will write all these things in your nurse's notes, okay? At 830 hours, seen examined by Dr. Muhammad, OBS consultant with new orders left and to be carried out. So this is the type of source-oriented or the narrative traditional nursing notes, okay? Now we have the focus DAR. Okay, focus DAR, this is the example. We have the date, the time, the focus. So, what is the focus? That is the problem. So, the focus, the problem of the patient is pain. So, what is your progress note? So, you have the data. Okay, the data, since the patient have pain, you will write complaints of pain at incision site. Okay, and then what is your action? Since the patient complained of pain, what you will write in your nurse's notes? Of course, the patient is in pain, you will reposition and supported with pillows, injection morphine, 10 mg IV given. You will continue this one as ordered, always as ordered by the doctor, if there is medication, okay? And then, what is the response of the patients. So this is the response. Of course, after your intervention, your nursing action, what is the outcome of your action? So the patient verbalized relief from pain and able to sleep. So that is your response of the patient after your nursing action. Okay, that is what you call focus DAR nursing documentation. Okay, we'll go next. Focus data, that is the same. Okay. Now there are different types of nursing documentation. Okay, when the patient is coming to emergency room, and then till admission, till discharge, nursing notes you have to write. Upon admission, upon entering, coming to the ER, emergency, and upon receiving in the ward, and till patient's discharge, you have to write your nurse's notes. Okay? Now we have two mnemonics for receiving admission. So, you will remember these mnemonics, A, B, C, D, E, F, G. So, you have to document all these things. In airways, what you will assess in airways, of course, the breathing. If normal, if there is stridor, if there is difficulty of breathing, you have to assess the airways when the patient is coming, okay? And airways, of course, if breathing normal, you will write normal. If there is something wrong, you will assess according to the patient's condition. Brain, what is you will assess in the brain, especially those patients in ICU, they are comatose, like ventilated. So what you will use this Glasgow-Coma, okay, scale, okay, and circulation, okay. You can check what are the circulation. You will check what you will assess in circulation. If there is any what circulation problem related, pulse. Okay, respiration, if any cyanotic, heart rate, okay. When the patient coming to you also, you have to assess. Please don't be noisy, please. See, this, if there is any drips, when patient coming to you, you have to assess if there is any drips, any drains, any dressing. So you have to describe all this in your nurse's notes. If it is intact, if there is any signs of infection, if the drips is or drains is leaking, whatever. If there is any volume of the pus, of the blood, all these things you have to document, okay? Elimination, like bowel of the patient, if he's there is bowel normal bowel movement, and urine also, okay, output, and then emotional status. If your patient is having this, maybe feeling anxious, irritable, all these things you have to describe in your and write in your nursing documentation. Fluid balance, okay, if there is imbalance in the electrolytes, okay, maybe patient you assess. Maybe skin is very dry, maybe dehydrated, okay? Gastrointestinal, if there is any like gasping, pain in the, okay? All these things you have to assess and record in your nursing documentation, okay? This is example for this gastrointestinal nurse's notes, okay? This is the background, this is patient's condition. Okay, a 34 years old female, Rabia received from ER, on stretcher accompanied by RN Sidra with diagnosis of duodenal ulcer under care of Ali, Dr. Ali. Patient had complaint of acute upper abdominal pain, not relieved by taking Semico at home, so was brought to ER and shifted to BI ward, spontaneously breathing in room air with bilateral equal chest movement, regular easy breaths. Patient is conscious, awake, and well-oriented to time, place, and person. Has IV on right hand, no swelling or redness observed, getting normal saline at 100 cc per hour, kept NPO, pass urine spontaneously. This is another type of nursing documentation. Anyway, I will show you later. We have lot of nursing documentation sample. Upon admission, till admission, any department, okay? I will show you. So what to do in nursing documentation? Of course, check that you have the correct chart before you begin writing. So when you take the patient's file, Make sure this file is to the correct patient. Just don't take anything. Please make sure to check first, okay? Another one is to write clearly, accurately, and legibly, okay? Some nurses, you cannot read the handwriting. It is like ECG, okay? You see, this is what I'm telling you. Use only military time format, okay? Always only use black ink, no other ink for nursing documentation, okay? Use hospital-approved abbreviation and symbols. Formulatory also. Document all procedures performed with complete description, including patient's outcome. Chart patient care at the time you provided it. See, some nurses document only on first-hand knowledge, and then chart the time you gave a medication, the administration, route, and the patient's response. Okay, this is what we're. Document complete information about the medications to provide concise information of nursing action rendered to patient. Okay. Use proper spelling and grammar. Okay. Avoid useless and unnecessary words. Consult dictionary if in doubt. Anyway, we have no Google. But as much as possible, avoid taking verbal and telephone orders as much as possible. Now, I will explain to you. This rewrite, you remember this acronym. R is for repeat order. Okay, repeat order. When to repeat order? When it is applicable, in emergency only, or without opportunity. So repeat order, this is, you will understand after we will finish. And then, write details of physician's order. Okay. The doctor is required to consign in 24 hours. Identify patient for whom the order is made, and then 2 nurses verify the order. Okay, the order. Okay, I will explain to you. Okay, this repeat order, okay, it is only applicable in emergency. It is in the verbal order, like in Code Blue. Okay, there is a Code Blue in the cardiopulmonary arrest. Only they will do verbal order. Okay? Okay. That is only in emergency. Okay? And then this another one without opportunity, that is applicable for telephone orders. Okay? In telephone orders, what you will do, you will take the phone and you will call the doctor. You will call the doctor. Okay, maybe he went for pray, and then he call you. And then this call, you answer the phone, and then you put on the speaker mode. Speaker mode, 2 registered nurse will listen to the order of the doctor. 1 will write and 1 will listen. Okay? After, let's say, I order you, sister, you give injection Panadol 500 milligram IV. You repeat the order to the doctor through telephone. Write down, repeat back. 1 will write down, 1 will repeat back. This is the one in telephone orders, okay? Okay. And then after that, you write the order in the doctor's form, okay? Physician order form. Within 24 hours, he should come and sign, okay? You will write the order, you will sign, and the countersign of the 2 nurse, and he will come within 24 hours to sign the order, okay? And then this is the 2 nurses verify the listen, okay? Listen, the order is safe. So this things only happen usually in evening and night shift. Why? Because there are less doctors in the night evening, but in the morning there are more doctors. Okay, that is only usually happening in the evening, in the night. Maybe you're in ER and only 1 doctor is available there. So he was out of the hospital. Maybe he went to pray. So that's why it's only usually happen in the evening, in the night. It is clear? Telephone order and verbal order. When this verbal order applicable?
In emergency.
Like what? Code Blue. What about telephone orders?
Telephonic orders are without other opportunity.
Yeah, maybe the doctor is out of the hospital, okay? Also chart promptly. Clear, identify care given by the another member of the healthcare team. Okay? Identify late entries properly, okay? This is the one, the example, okay? Date and time your entry on the next available line. Refer to the time documented event happened in the narrative. Example, this is the date, okay? This is the time, 414 hours. Late entry, you write late entry. And this is the nurse's notes, okay? Because maybe I am morning shift, okay? And your evening shift, okay? And then after you write the nurse's notes in the first page, you receive the patients already, and I forgot to write my nurse's notes from morning. So what I will write, I will insert in that empty, because you cannot close your notes, your evening, still you're starting. So I will insert, I will write these things, the date, the time, okay, and I will write late entry. And this is the notes I forgot to enter in my morning shift. So I will write these notes. This is the one I forgot. So you will write, they will know this is late entry from the morning shift. If you write late entry, but if you will not write late entry, it will not be clear. So if the shift, the receiving shift, they know this is from morning shift, late entry. So forgot. So this is how you write your late entry. But now we will go to mistaken entries. Okay, mistaken entries. This is the example, okay? You write the date here, and this is the time. So this is my nurse's notes, okay? Client complains of pain, open, close parenthesis. This is the pain scale, okay? 6 on a 0 to 10 pain scale. This is the pain of the patient is 6, okay? When position on the right hip, right hip, okay? You see, what is my mistake here? Is right hip. Instead left hip, I wrote right hip. So, what I will do now, since this is my mistake, I will cross one line only. Okay, one line, I will write on the top, ME, better ME, no need a mistake entry. Okay, ME, and your initial. So, you will continue, and this is your signature, and your day, name, and your signature. Clear? That is my mistake. Instead of I should write left hip, but I write right hip. So that is my mistake. Okay? That is what you call mistaken entry in the nurse's note. This is happening. So that's why we are not allowed to use erasures, white ink, or doing like this. Only you draw one line. That is your mistake, and you can continue your nurse's note. Okay? It's not allowed to do in the nursing documentation. Don't alter a patient's record. As I mentioned, erasures and fluid correctors are not acceptable. Okay? Don't use shorthand or abbreviation that are not widely accepted. Okay? Don't chart what someone else said, heard, felt, smelled, unless the information is critical. These things sometimes is really happening because we are want to help our colleagues. Sometimes I will give you example. I help you because you are busy. We have no time to write. So I write notes for you. Okay? But I did not attend the patient. So something happened now to the patient. Patient died. But I'm the one who wrote notes. I'm the one signed them. So I will be responsible. I will be the one to answer for all this happening. So as much as possible, just avoid. Okay? Don't chart ahead of time. Okay? Don't leave any blank space in patient's medical records. You will write continuous, so don't leave any blank. Don't sound tentative. Okay? Should be specific. Don't be subjective. Okay, what to document? Independent nursing functions. What is your dependent nursing function? Give me example. You have the dependent and independent. Dependent. Dependent nursing function. What is your dependent nursing function? That you cannot function alone. So this one means you cannot just give any medication without the doctor's order. So this is what you call your dependent nursing action. Somebody like doctor should order you. You cannot carry out without the doctor's order. Okay? That is dependent nursing function. So we'll go now to independent nursing function. This is your independent. This one means you can do without another people will order you. Like what? like your assessment, like your vital signs, like your bedside care. All these things, no need for somebody to order you. You can do it without order. Okay, that is what you call your independent nursing function. Okay? Measures carried out by the physicians. This is what to document. Visit by members of healthcare team. Okay, like when patient may be like in delivery room, in labor, but she have a medical condition. So they will refer this case to the medical side. So whomever will come to the patient to see, you have to include also this one in your nursing documentation. Okay? Also, refusal to submit to therapy. Patient refuse, you have to also document, and we have also this form for him to sign if he will refuse. Okay? And then reason for treatment and medication omitted. And then unresponsive and no distress, non-verbal, non-communicative, and offers no complaints, irregular heart failure. Okay? Accurate description of patient's complaints and measures taken.